detail. Overdoing it with supplemented niacin can cause something called niacin flu in your body, which feels like redness, heat and itching all over the body. Although it is not dangerous, it is quite uncomfortable, but be careful, this vitamin is just the beginning. Now I want to tell you about another one that is very important for the health of your blood vessels. Vitamin C, also known as ascorbic acid, is key for you to know its medicinal secrets. This powerful antioxidant has a direct effect on your blood vessels, strengthening their walls and helping them stay flexible and resistant. This keeps the pathways through which your blood circulates strong and in good condition, withstanding the damage that can occur over the years. In addition, vitamin C plays a very important role in the production of collagen, a protein that acts as a natural support for the walls of arteries and veins. This reinforcement is essential because it protects the structure of these vessels. When collagen is in good condition, it reduces the risk of varicose veins and other circulatory problems caused by the deterioration of the vascular wall. These effects are even more important in the legs, where the blood vessels are under greater pressure due to gravity and the distance from the heart. For this reason, a good dose of vitamin C improves circulation in both legs and feet, also reducing inflammation in those areas. This is super beneficial for those who suffer from restless leg syndrome or that feeling of tired, heavy legs at the end of the day. And what are the best sources of this powerful vitamin? Fresh citrus fruits like oranges or lemons, as well as kiwis and strawberries, are some of the best. Ideally, these foods should be consumed as fresh as possible, because this vitamin spoils quickly when exposed to air and light, which means it loses its effectiveness if you store cut fruit for too long. And many people don't know this, but a guava has more vitamin C than an orange. And that's not all. This vitamin is also found in vegetables like broccoli, red peppers, and spinach. Now, be careful. Although vitamin C supplements are available to anyone, it's extremely important not to exceed 200 milligrams per day, as this can cause digestive discomfort and increase the risk of kidney stones. That's why it's always best to prioritize natural sources that provide it safely and effectively. Supplements should only be considered in specific situations and with a prescription. Now that we know how essential niacin and vitamin C are for circulation, it's time to talk about another key nutrient, vitamin K. This vitamin is essential for protecting the circulatory system and preventing clots from forming, allowing blood to flow optimally to the extremities, thereby improving the health of veins and arteries. Its main function is to precisely control blood clotting, preventing both bleeding and the formation of dangerous clots. Additionally, vitamin K plays a crucial role in preventing calcium from accumulating on the walls of the arteries, which prevents them from hardening and the development of atherosclerosis, a condition that reduces blood flow and increases the risk of serious problems such as heart attacks and strokes. To obtain it naturally, green leafy vegetables such as broccoli, spinach, and kale are excellent options. These foods not only give you vitamin K, but also antioxidant and anti-inflammatory substances that protect all your cells, along with fiber, which is very good for the intestinal microbiota. In addition, kiwis have vitamin K and are very easy to include in your diet. I recommend preparing and drinking a green juice rich in antioxidants, potassium, magnesium, and vitamin K every day. Make it with celery, kale leaves, a kiwi, or a red apple to sweeten it. A piece of ginger, and to give it freshness, a few mint leaves. If you want to sweeten it a little more, a teaspoon of cinnamon is an excellent option. I suggest drinking 1 glass a day in the morning, without straining. But be careful here. If you are taking anticoagulants such as warfarin, it is important to know that you do not need to reduce foods rich in vitamin K. The problem is not eating them, but making sudden changes in your consumption. Understand this. What your Dr. Castillo does during your appointment is adjust the dose of the anticoagulant so that its effect always remains stable in your body, and this depends on your vitamin K levels also remaining stable. So, if one day you eat a lot of broccoli and the next you don't eat any vegetables, this can change the effect of the medication, making it less effective or too strong. That's why it's best to always maintain a constant amount of vegetables in your diet and consume them regularly and in a balanced way. And if for some reason you decide to increase or decrease your consumption, talk to your Dr. Castillo first so that he can adjust the dose of the medication and thus avoid problems. Now we come to one of the most powerful vitamins for circulatory health. Vitamin E. This nutrient is well known for its antioxidant properties that help protect our cells from daily wear and tear. To understand it better, imagine that your blood vessels are like water pipes. Over time, these pipes can rust and weaken, especially if they are constantly exposed to harmful substances. Free radicals are precisely those bad substances, small particles that circulate through the body and that if left unchecked can oxidize and weaken the walls of the vessels. Vitamin E acts as a protective shield, preventing these free radicals from causing damage. This way, your arteries and veins always remain strong and flexible, allowing better blood flow and reducing the risk of diseases in the heart, brain, and legs. In addition, this vitamin is essential for preventing the formation of clots, which greatly reduces the risk of obstructions in the circulation, but its benefits do not end there. Vitamin E stimulates the production of nitric oxide, a molecule that causes our vessels to relax and dilate. This process, called vasodilation, facilitates the passage of blood and lowers blood pressure. This allows the heart to work more efficiently to obtain its benefits. Foods such as the yolk of free-range eggs, especially almonds, pumpkin or sunflower seeds, and vegetables such as spinach and broccoli are very rich in vitamin E. In addition, avocado is a natural source, especially when you scrape off the darker pulp that is attached to the skin. And many people don't know this, but extra virgin olive oil, which in addition to having good fats, has vitamin E. Regarding supplements, my opinion is that they are not necessary unless your Dr. Castillo tells you to for a specific reason, such as poor absorption due to intestinal problems or a proven vitamin E deficiency. In fact, high or uncontrolled supplements increase the risk of complications such as bleeding. On the other hand, a single 30-gram serving of almonds, which is equivalent to a small handful, already covers almost 50% of the recommended daily dose. And if you supplement your diet with a diet rich in green leafy vegetables and healthy oils, the levels of vitamin E you will obtain are more than enough to protect circulatory health without the need for extra supplements. And that's it, yeah. Did you know that poor circulation is the cause of discomfort in the feet, legs, and knees of millions of people? Just like you, many suffer from pain when walking. Cramps at night, swollen legs, tingling, and heaviness, without knowing that the problem lies in their blood vessels. Healthy circulation is essential for the optimal functioning of the entire body. And when this system fails, it often causes problems such as varicose veins, which are dilated veins that do not work properly, as well as hard and blocked arteries in your neck, heart, and legs. A condition known as atherosclerosis. In addition to the problems mentioned, poor circulation can also cause your wounds to take longer to heal, your leg muscles to become weak, and other problems such as neuropathy can worsen, causing burning sensations and painful tingling in your feet. And the most worrying thing is that when there are circulatory problems, the blood can stagnate and become thicker, especially in your legs, and this can lead to the formation of clots or thrombi, both in the veins and arteries, which further alters blood flow and, in some cases, can be very serious. But you'll be surprised to learn that you can improve your circulation naturally with home remedies that I'm sure you already have in your area. Today I'd like to introduce you to 4 essential vitamins for a strong heart and excellent circulation that help blood flow harmoniously, preventing clots or thrombi from forming. And pay close attention to the last 2, because those are super tricky. Come on, get started on this, because circulation problems sometimes appear little by little without you realizing it at first. Although they can affect anyone, they are more common in older people with heart disease, high blood pressure, diabetes, or who smoke. That's why controlling these ailments is so important to help improve your circulation as part of your treatment. Look, my friend, there are 5 warning signs that can let you know that your circulatory problem is getting worse. If you notice any of these, in addition to using the natural remedies that I'm going to tell you about, get on with it and seek medical help as soon as possible. In these cases, an imaging test such as an ultrasound along with a clinical evaluation by Dr. Castillo can help you treat the problem in time to prevent it from getting worse. The first warning sign is that numbness or tingling that you feel all the time. It's like an uncomfortable tingling in your legs and feet that appears very often, especially when you spend a lot of time sitting, cross your legs, or stand for a long time. If you notice that this happens to you frequently, it's a sign that your muscles and nerves aren't getting enough oxygen. The second sign is having cold feet all the time, even on the hottest days. That can also be a reflection of poor circulation. Sign number 3 is leg cramps while walking or exercising. They are so intense that sometimes they force you to stop dead, to stop what you are doing. And that happens because your muscles lack oxygen and nutrients during activity. This is called intermittent claudication, and it is clear evidence that the circulation in your legs is failing, for whatever reason. Many times the cramps are more intense at night, forcing you to jump out of bed or give yourself massages to relieve them. Some people, instead of cramps, suffer from restless legs at night. This feeling of being unable to find a comfortable position prevents you from resting and greatly affects your quality of life. If you have felt this discomfort, it means that the circulatory problem is already affecting your nerves or is worsening any neuropathy you may have, and you should not ignore it. At this point, I want to tell you that all of this has a solution. In many cases, the anger can be reversed, especially if you start using the natural remedies that I'm going to tell you about. Sign number 4 is that your skin color changes. It may look paler or purple with a bluish tone or dark spots, brownish brown in color, may also appear, especially on the feet and near the ankle. This is also a sign that your blood vessels are damaged, and not only does it affect how you look, but it also makes wounds take longer to heal and your legs swell easily. And the 5th sign is varicose veins and spider veins. These are like swollen and twisted veins that appear on the skin with a reddish or bluish color. They usually happen when the walls of the veins are weak, damaged, or their valves do not work well. This causes the blood to circulate in a direction that it should not or to stagnate, causing all the symptoms that I mentioned. All these signs warn you that your circulation needs attention now. At least to rule out that you don't have a more advanced problem and you can start treatment as soon as possible. Now let's review the 4 vitamins to improve your circulation and strengthen your veins and arteries. The first is niacin, also known as vitamin B3. It is a key nutrient because of how good it is for circulatory health. This vitamin works to maintain the flexibility and strength of blood vessels, helping to prevent them from becoming blocked, reducing the formation of clots, and improving blood flow. This is super important for people who have varicose veins or venous insufficiency. In addition to improving circulation, niacin plays a very important role in heart health because it helps regulate cholesterol. What it does is lower LDL cholesterol, known as bad cholesterol, and raise HDL, the good cholesterol. This is essential to prevent plaque from forming and clogging the arteries, keeping them clean and open so that blood flows well. When these cholesterol plaques accumulate, they harden and narrow the vessels. This makes it difficult for blood to pass through and increases the risk of serious problems such as heart attacks, strokes, and circulatory disorders in your legs. That's why having good levels of this vitamin prevents all that damage and at the same time protects the health of your heart. But the benefits of niacin go much further than just the brain. It protects neurons from the damage that comes with age, improving memory, concentration, and allowing for healthier aging. Now, how can we effectively get this vitamin? Niacin is found naturally in several foods that you surely already have in your home. Eggs, for example, are an easy and accessible source for breakfast. Chicken, especially the breast, is a great option because it is low in fat and rich in niacin. Just make sure it is hormone-free. As for fish, salmon and tuna are excellent, not only for niacin, but for other nutrients such as vitamin D and healthy fatty acids. Finally, nuts like almonds are a very practical option, ideal for those cravings or snacks between meals. The daily amount of niacin that we should consume varies from person to person, but for an average adult the recommended amount is between 14 and 16 milligrams per day. This amount can be easily obtained with a balanced diet. For example, a 100 grams chicken breast already gives you more than half of the niacin you need per day, and supplements are not really necessary in most cases, as long as you include these foods in your diet. However, in specific conditions such as nutritional deficiencies, chronic alcoholism, or certain intestinal diseases that cause poor absorption, supplements can be useful. Of course, there is an important